Hello, and welcome to Tuesday Talk. Today, we're going to be talking about the overview of Project Open, which is a federally funded grant that KSB has been leading for a number of years. Today, joining me, we have Natalie Andrews, the first project director for Project Open. Her and many local leaders joined forces to get the initial planning grant. Natalie's going to go over some of the why, the who, the what, and some of the activities they did that have led us to where we're at today. Natalie, why don't you go ahead and please introduce yourself? And again, thank you so much for joining us today.
Thank you. I'm Natalie Andrews. I have a 30 plus history of working in the field of mental health and substance using disorders. And upon retirement, I connected with some friends and business associates to write grants and to help people in the community to bring funds into our local area. Greg Gates from the LOTS Transportation and Kyle Allman, the administrator at Public Health, were co-writers on this. And basically, we reviewed the HRSA grant, Rural Communities Opioid Response Planning Grant, which back in 2018, 2019, there was funding for such to address in communities because of the prevalence and the severity of the need with opioids and other substance using disorders. We put together some things, took it to KSB, to Dr. Nog, and started discussions about the needs in our area and what the gaps were and how we could put something together working with the community to address this issue. It was determined that we'd look at Lee and Ogle County as target areas, and it was determined in our preliminary discussions that we did not want to target just a sector of a community. So we chose preconception through death, because we know that there are children that are born that are addicted. And we wanted to be able to have a large span to target with helping. So basically, we got the nod from KSB, and we met with key stakeholders within the community, wrote the grant, and were awarded the grant. And based on the need in our area. And then we needed to meet the requirements of that. And then I came in as project director for Project Open. And one of the deliverables was you needed to have memorandums of understanding and bylaws and infrastructure and governance. And how I look at that is really, getting people together that in our area are used to working together. And we're talking key stakeholders. We're talking high-level key stakeholders, decision makers. Wanted them to get together to look at how can we address substance using disorder, specifically opioid, but also others, and how it impacts our community. So the first initial piece was just getting people to the table, building relationships, making connections, trusting each other, learning different perceptions. We all have different perceptions about substance using disorders. And so we spent time learning those perceptions and what are our beliefs and where do they come from? What's the root cause of substance issues? It shouldn't surprise anyone that some people believe that this is a moral issue, that it's a choice. It's something people should just stop and do. And we worked through those pieces. We got to a stage of agreement of what vision do we have, what mission do we have. So we developed a vision of Lee and Ogle County free of substance misuse, because the language is changing so in the field of addictions. It's no longer addictions, it's substance using disorder. So we are not using abuse as much or dependency, so we use the word substance misuse. We then worked on a mission, and our mission basically was to work collaboratively as a community service providers and with concerned citizens to implement a multifaceted, innovative, and sustainable prevention, treatment, and recovery strategies to lessen the devastating effects of substance misuse and mental illness while addressing social determinants. It is not surprising that these are very interconnected issues that occur, and discussions were, we want this to be broad. We want this to be community-based. We don't want this to be only within the schools or only within law enforcement or only within the treatment provider. But how do we work in concert with each other and share information? So one of the second task or deliverable that we needed to provide was a needs assessment and identifying gaps. We looked at 3 different assessments for this to compile data, and we wanted to identify the needs in several areas. One, we used the opioid adverse drug event prevention gap analysis, which really addresses hospital-based patient and medication safety. We knew that the opioid epidemic was spurred on by overprescription in some areas. And so we used the results of that survey to identify gaps in practice, and also looking at areas where hospitals are. The 2 hospitals that took it were KSB and Rochelle Community Hospital. They were very strong in the area of providing patient education on this, protocols for management of opioids. But we also had areas where we could improve on that. So that was the first assessment tool that the hospitals did. The second one was called a sequential intercept model. And that really is a tool that was developed to identify how substance use individuals flow through the community and what services are available to those in need. We know that as a treatment provider in the past, we get people at a certain point that come in and need help. We also know that the emergency room in hospitals is another intercept point where people need help. We also know that law enforcement has contact with individuals that have substance issues. So all of those different intercepts we wanted to look at, and basically that was a electronic survey that went out to city police departments. How do you handle things? County sheriff, local and court systems in both counties, probation departments, all interact with that. Schools were important, treatment providers. So we asked them to identify their agency strengths, their weaknesses, and areas for improvement so that we could look at gaps and what was identified. I'm just going to kind of summarize real quickly. One was we need a way to share information and data, a warehouse or somewhere that we could even telehealth to share information. We need a process to get individuals into services. We need more community supports outside of treatment. Treatment is one piece, but what about after they go through treatment? What are the community supports? We need to address trauma-informed communities. That's a core issue when you look at root causes of why people use substances. It's really, you have to get to that upbringing and how we were raised and what beliefs and where we are and what how we interact and the traumas that we've had that adversely affect us. And then we need to expand medication-assisted treatment because we knew we only had one resource locally Otherwise, you had to go to Chicago. We also knew that we had strengths. When we looked through everything that we compiled from people, we knew we had excellent hospitals in both counties. We knew that in Lee County, we had a psychiatric unit. We knew that Sinisippi had a recovery home in Dixon. These are all positive assets. We knew we had safe passages for accessing substance abuse treatment. That was an avenue to getting treatment. We also knew that we had probation and drug courts that were interfacing well with treatment. The third component of our needs assessment was key informant, and that was basically a community survey asking people who were current users, people who were in recovery, and family members who had been touched by this disease to look at what could we do different, where are the gaps, where are the needs. So we compiled results from that survey, and I know I'm going to take a minute, but there were a couple of things that I thought were interesting on what people said. Some of the individuals in recovery would say, tell doctors to prescribe something else for pain, get rid of the pills. Another person in recovery said, classes that inform the community of drugs and how it affects the whole family. So they gave recommendations, and these are important things for strategic planning because you want people who are living that experience. One family member had said, these issues are complex and not as easy as stop prescribing or just stop using. We have to remember that this is a disease, and you just can't tell someone who's in a diabetic situation and having problems or to say, just start breathing. No, it's a disease concept that we work from. And so we were able to use that information gained from the community to develop a strategic plan. And one of the things about a planning grant is it's not real action oriented. A lot of people want to do it and get it going. And I'll tell you, you got to pull them in and you've got to say, no, that's the next step. This is a whole year of sitting around the table having meetings. I'm sorry. At least we could have meetings back then. So face to face at least. But anyway, developing the strategic plan was the next piece. So we reviewed all of the information from the needs assessment. We developed a problem statement, and it was 46% of individuals currently using and individuals in recovery report obtaining their pills through a doctor, hospital emergency room, or people selling their prescriptions. This is a national world issue. It is not just our area, but to have people come out and say that, key stakeholders in our community to say that, it really aligned with a lot of what was going on nationally. So we identified a target population, that preconception to death, long-term, short-term goals. I'm just going to tell you a couple of goals. One was decrease the access to opioids through regulation of prescribing practices in Lee and Ogle County. So that meant many things that you will hear. I'm going to leave that to Aaqil because I know I'm probably going over on my time. But it was hospitals forming work groups. It was increased community awareness, media campaigns, and becoming trauma informed as a community. How do we do that? That would be the next step. Goal number 2 was really to strengthen the behavioral health system infrastructure in Lee and Ogle County. And that's a big ask. That's a big ask. You've got organizations that are used to managing and working from a certain perspective because they have all regulations and things that go towards their funders. But what we're looking at is how do we as a group increase the knowledge of how to direct individuals to access treatment, to identify and build capacity with our workforce, because we knew there were workforce shortages. How do we employ community-wide approach to screening for behavioral health disorders? And how do we execute our workforce plan, our development plan? How do we get staff in here? Well, the next deliverable we had to do was a workforce development plan. And really, that's looking at, do we have enough licensed staff? Do we have waivers in place for doctors who can prescribe naltrexone and those pieces? So workforce is a big piece of this and much needed in a rural area. The other is the last deliverable, the fifth deliverable, was develop sustainability plan. And really, a sustainability plan is about operationalizing and sustaining activities in our community so that we just don't seek grant funds and then that all stops. We want this to continue. We've identified strategies to sustain the functions, to continue, and that's the goal. And we have the next 3 years, luckily, to do that. So by the spring of 2019, we realized that there was enough interest in the community that Whiteside County was interested in joining in. And at that same time, HRSA had announced a notice of funding for implementation, for 3-year implementation planning. So we started meeting that summer of 2019, and there was a transitional month where we had both grants, and that's kind of where I phased out, and then Aaqil came in as project director to do the September of 2019 to start that implementation on that. So Aaqil, I'm gonna turn it over to you. I appreciate it.
Natalie, thank you so much for joining us and taking the time to be with us. And you really are one of the co-founders and one of the initial people who brought this to the table and made it happen. And we wouldn't be here today if it was not for all the efforts you took in. It was all the work you did as part of the planning process. I was on the planning group, primarily focused on data analysis and technology, but just watching the discussion happen, watching everyone's opinions change and grow and be part of the solution and move together was large in part due to your leadership. So thank you so much for everything you've done.
Thank you. It's a team effort. Bless you.
I appreciate that. I know you might have to run, so please hop off at any point you need to.
Okay.
Again, thanks so much for joining us. And where I'll pick up now is exactly where Natalie dropped it off. In September of 2019 is when we had the implementation grant. Natalie ran the planning grant, which was a 1-year, $200,000 grant. As she mentioned, there was no actual implementation activities, which were frustrating at times, but you really had to go through the process of understanding where everyone's at and where everyone believes they need to go. And when we got to the table with Whiteside, they had a lot of strong resources, a lot of strong players, another amazing large medical facility, other behavioral health providers like LSSI, a federally qualified healthcare center housed underneath the Whiteside County Health Department. But then there was also compelling data. There were higher instances of opioid overdoses, not fatal and non-fatal, over certain years. And so getting that group to the table and those players at the table really broadened the horizon. And our consortium grew at that point slowly. We had law enforcement, probation, judges, transportation, education, healthcare providers, behavioral healthcare providers, non-for-profits like United Ways, YWCAs, U of I Extension. And we started to then include the faith-based community, working on building inroads with other agencies like the Department of Corrections. And the implementation grant really started to take flight, large in part to the work that the planning grant laid down. And there was a lot of gaps that they identified and a lot of priorities that they identified in the planning phase that we worked into the implementation grant application to say that, hey, look, if we were to get funds for a longer duration of time and a larger subset of funds, this is what we would do with them based off what we identified in the planning grant. And we were very fortunate enough to receive a 3-year, $1 million implementation grant underneath the same HRSA, Health and Human Resources Service Administration, RCORP, Rural Communities Opioid Response Program grant. And so the main branches, the main arms of this grant were prevention, treatment, and recovery. And there are a number of goals and objectives underneath each one of them, and I'll summarize them. Prevention was ultimately to reduce the occurrence and associated risk of substance use disorder among new and at-risk users. And keep in mind, this was an opioid-specific grant, but we knew that substance use is opioid is just one part of it. It was a big part of it, but just one part of it. There's methamphetamine, alcohol, and other substances that we needed to make sure that we included in the scope of the project. And in the prevention, there was a big focus on youth, and I'm excited to share with you some of the projects and initiatives we've launched underneath that. With treatment, it was to implement and expand access to evidence-based practices. Natalie mentioned medication-assisted treatment. There was detox. There was other psychosocial interventions, inpatient, residential treatment, recovery homes. Really working on a holistic ecosystem for treatment. And then finally, on the recovery side of things, it was to implement and expand access to recovery and treatment options to help people who are battling substance use and opioid use disorder. And when we had these three goals, we had this aha moment where really the underlying goal, the aspirational ultimate goal for all of this, was to break the intergenerational cycle of trauma, because we know that broken children can oftentimes become broken adults who then raise broken children, and that cycle can continue. If we can go and intercept, address some unmet social and emotional needs in children, ensure that everyone has proper access to medical, behavioral, dental, vision, all care spectrums, that we could then hopefully break the intergenerational cycle of trauma. Because in our first episode of Tuesday Talks, Daniel Hostetler mentioned that before substance use is actually loneliness. And there's a lot of early childhood age trauma that leads to substance use. So our ultimate goal was to break that intergenerational cycle of trauma. Now, I mentioned that was a 3-year, $1 million grant. Our budget was, at first, we're like, man, how are we going to spend $1 million? But as we started to allocate it, you'd be surprised at how quickly the money went. Some highlights for the budget categories: there was personnel. I'm a full-time employee of KSB, but I've been fortunate enough to have a portion of my time allocated to grants. And so some of my time as a director was allocated from there. Our outreach and marketing team had some time. Our accountant was able to dedicate time to help us with the finances and all the federal submissions associated with the federal grant. We looked at hiring nurses, school-based counselors. There was funds for a case manager, recovery community organization staff like recovery coaches and peer support personnel. And there was a lot of in-kind funds, large in part by KSB, who dedicated time from VP and C-suite members to the project, and other staff like pharmacists to all contribute to the grant, but not necessarily take money from the grant, because there was other things we wanted to use, such as things for training, like Narcan administration for the public or academic detailing for prescribers, but we'll get into a little bit, mental health first aid. There was travel for conferences and meetings, and there was also money set aside for like technology solutions. And I'll talk about a couple of those that we're working on today. The project was really big. Just in year one alone, in our work plan, we had over 60 items that we wanted to work on. And so we ended up breaking the project into 6 main groups, and we called them our champion groups. The 6 groups were prevention, provider and treatment, media and community relations, workforce development, technology and information systems, and recovery. And these groups were very deliberate in that all the activities we had, they could mostly fall into one or more of these categories. And then we had our consortium members, which currently today are over 50 consortium members spanning almost 40 organizations. They all decided what areas of interest, best fit them. Because with such a big project, we couldn't meet with the whole group every time and get get our items done. We had to break up the project and meet more regularly. And these champion groups meet at least once a month, and the larger consortium meets for big updates and more highlight events every 3 months. So I'm going to go through each of the groups real quickly, kind of talk about the focus, some recent accomplishments, and what the current projects are for the group. In our prevention group, the main focus is to address the unmet social, emotional, and behavioral need for youth. So that meant going into schools, increasing screenings, conducting trainings for educators and other professionals, trainings like Project Alert and Handle with Care. And the recent accomplishment is we just completed a very large school service analysis. We looked at all the providers in our area who were providing services in schools, from Sinisippi to LSSI, Whiteside County Health Department, Morrison Community Hospital, and identified who was doing what in each one of the schools in our Tri-County area, to what frequency, on what days, And then looking at that student body population, we were able to identify what schools could use more services or what schools weren't getting services at all. And there were some big schools who didn't have as many services as some of the other big schools. And so now we've started to work with those providers to start to expand more and more into those schools. And part of the funds that we had were to hire school-based health counselors to go in. There was a waiting list prior to the grant for children who needed counseling help. We've able to address that waiting list by hiring 2 school-based health counselors who are working full-time in the schools now across our Tri-County area. The current project for the prevention group is to conduct a focus group with school-age youth to understand their perspectives on opioids and how to help their peers avoid substance use. This project has been slightly delayed due to COVID and our inability to get into schools, especially with the virtual learning. And we're really optimistic in fall of 2021 that we'll hopefully be able to get in and start to conduct those youth surveys. For our provider and treatment champion group, our focus is to expand access to services and engage providers in finding reimbursement strategies and opportunities. Just really looking at the entire provider's ecosystem and what we can do to ensure that they are all aligned on practices and moving forward together. And one of the recent accomplishments is Whiteside County Health Department had a well-established, successful MAT program. An MAT is where an individual who's using opioids needs to very strategically and carefully reduce their opioid usage to a safe level where they can safely stop using. And MAT helps them do that in a controlled environment. We were able to bring their MAT program into Lee County, and that is launching actually now this month in July of 2021. And Mississippi also was able to get some providers data waivered, which is a federal waiver to be able to prescribe some of the medications associated with MAT. And actually, the new term for MAT is actually MAR, medication-assisted recovery. And that is just, again, to help with the stigma and change our language to make it more accepting. So MAR now is being provided by Mississippi in Lee and Ogle counties. And that was a major win to be able to bring in a Whiteside County provider into Lee County and to get Mississippi their program off the ground. And a lot of it happened through, key meetings with police chiefs and sheriffs and all the local behavioral health providers and hospitals to make sure that that happened. The current project right now is looking at local detox services. And we're also looking at conducting academic detailing. And as Natalie mentioned, 46% of people identified getting their opioid prescription from their doctor's office. So we want to do academic detailing with pharmacists. We're partnering with the University of Illinois College of Pharmacy there in Chicago to help us work on a detailing program to meet with providers at month 0, month 2, and month 6, and kind of help them get introduced to the Illinois Prescription Monitoring Program if they haven't already, and just analyze the prescribing trends and hopefully work with them to just make them aware of their prescribing trends, and then they as clinicians can decide how they want to adjust if they need to adjust at all. For our media and community relations group, the main focus is creating awareness, addressing and preventing stigma, and really changing the language. As I mentioned earlier, right? MAT has now become MAR, not using relapse, not using abuse, not using the word addict. All these are simple ways that our community can start to change the language and help people feel less shameful or less judged when they want to come out and seek help. And the recent accomplishment is obviously the launch of our Tuesday Talk series. We're very, very excited to be able to continue to do this, and we hope you find value and join us in upcoming episodes. And the current project is continuing to grow the Tuesday Talk series and build community partnerships. For our workforce development champion group, our focus is coordinating training, addressing workforce shortages, and building capacity, both in knowledge and in numbers. And that was one of the things Natalie mentioned that was identified in the planning grant. So the implementation grant is working on closing some of those gaps. A recent accomplishment is that we were able to partner with Best Inc., who had a complimentary grant, a misplaced workers grant. So we were able to help share clients and get them placed into jobs. And we also were able to conduct an employer survey and start to engage employers who would be willing to relook at hiring practices and that oftentimes preclude individuals with the felony that may be many years old. A big part of recovery is finding stable employment to maintain recovery. And so there's a lot of employers in the area. We're very excited to work with them on helping them sending them candidates, very qualified candidates, and streamlining that referral process to them. The current project for our workforce development group is we're going to be working on setting up a local recovery-friendly workplace program. And this program is already in multiple states, started in New Hampshire, And we're working on making a version in Illinois, and we hope to bring it to a statewide level. But right now, we'll be working with a few pilot employers in our area, some large manufacturers, to develop that recovery-friendly workplace program where not only will they hire people in recovery, but they'll make sure that their culture is recovery-friendly. They may even go as far as having support groups on site, and just kind of looking at policies to promote and foster a safe environment for individuals in recovery or seeking recovery. Um, our next group is the technology and information systems. Their focus is data collection, analysis, finding new and innovative solutions. Recent accomplishment was a launch of a novel asynchronous behavioral health platform, or a less stigmatized word we're trying to use here at KSB and Project Open is brain health, a brain health platform. This is available 24/7 where individuals can log on and answer questions about how they're feeling and get connected to a care provider within minutes, if not hours. And we have protocols for substance use, whether it be drugs or alcohol, depression, anxiety, PTSD, and ADHD. And so you can log on totally free of charge, available 24/7, and get connected with the clinician who can help you along your care journey. And we're trying to, that's an effort to make care as convenient as possible for anyone who may need it. And the current project for our technology and information systems group is trying to develop that shared technology platform to coordinate intake, conduct screenings, streamline referrals, and share data. Because as Natalie mentioned in the planning grant, everyone's got their own system. Everyone is very data rich, but as a community, we could be better, we could be better with our information, and so we're looking at a platform and are very close to securing a platform that will help us start to put everyone, all the behavioral health providers, hospitals, recovery community organizations, law enforcement, on one platform where we can work better to take care of our patients and our populations and shared clients. And lastly is our recovery champion group. Their main focus is connecting the recovery community, building supports for people in recovery, whether that be through housing, employment, peer support. The biggest accomplishment in the recovery group is the creation of Sauk Valley Voices of Recovery. They recently received their non-for-profit status, and they were actually just awarded a $40,000 grant from Rush to continue a lot of their efforts. And Project Open helps them with a monthly newsletter, monthly recovery activities, and a lot of staff support. The current project right now is we're planning for a very big celebration during Recovery Month, which is in September. The celebration is going to be known as RecoverCon. Maybe you've heard of Comic-Con. We're kind of making a version of that known as RecoverCon, where we're going to have speakers from all over the world come to town at Sauk Valley Community College and give talks. We'll have tracks for law enforcement, educators, and there'll be more details, and I'm sure an upcoming Tuesday talk to dive deeper into that. And so those are really the main 6 groups that work in Project Open. Each one of them have multiple members. We welcome community members. We would love for you guys to reach out. You can visit theprojectopen.com, reach out to us, call us, leave us an email at projectopen10@gmail.com if you want to join any one of these work groups or help with any project. And lastly, I'm going to close our talk today with just looking at the future. The biggest thing that we're going to do in the future is continue to expand the consortium. We really want to get deeper into the faith-based arena. We want to build solid partnerships with the Department of Corrections and local law enforcement and strengthen some of those handoffs. We'll be working on projects like harm reduction projects like syringe exchange. Soon we'll be connecting system-wide cultural and linguistic assessment to make sure that all of our area organizations are culturally competent, that we have everything in English and in Spanish, that we're able to help people who might be hearing impaired or visually impaired. We'll be working with state legislators to hopefully rewrite some old policies and develop new policies to support our projects. We're working on connecting the disparate transportation network. We hope to get that recovery-friendly workplace to a statewide employment programs, supporting those with criminal justice backgrounds. And a project that I'm very, very excited about that I think will have long-term impacts towards that ultimate goal of breaking the intergenerational cycle of trauma is the development and actual build of school-based health centers in key locations throughout our school districts and community. And these school-based health centers will not only address medical needs, but will have behavioral needs addressed in them, social, emotional, and in the perfect world, we'll expand to some of the bigger schools might even have dental and vision services. And these are all projects that are being conducted underneath the open umbrella with all the diverse players and multidisciplinary teams we've built. Again, I welcome you to visit our website or reach out to us on our Contact Us form to see how you can get involved. My name is Aaqil Khan. We've got another year plus of this grant. Very blessed to be able to work with talented members in our community who are very passionate about this topic. And we really look forward to engaging the community further and your involvement in being part of the solution when it comes to addressing the opioid epidemic and substance use disorder. We hope you have a wonderful Tuesday, and thanks again for joining us.